Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
Welcome to Health Watch presented by UMass Memorial Healthcare. We're looking at the importance of seeking a second opinion when dealing with a serious medical condition. Why would someone seek a second opinion?
Generally, patients seek a second opinion when they have been recommended to have a major procedure or a major change in their management. They may not be comfortable with having the procedure, or it may have some risk associated with it. And they may feel more comfortable if they seek an opinion from a second doctor who reinforces the opinion of their first doctor.
What should a patient do if the second opinion differs from the first opinion?
Then it would really depend a little bit on the way the patient interacts with the opinion of the physician. If they trust the second physician, or they find the second physician to have authoritative reasons why they may change the management, that might be something the patient may take under advisement.
Is there such a thing as a third opinion?
I'm sure that's done, but in general, most insurers will pay for a second opinion for major procedures or major changes in management. Typically, they won't if it's just about a medication, though.
What are some examples of a condition a person might seek a second opinion for?
Probably the most common would be recommendations for cardiac surgery. Recommendations to either have a heart valve replaced or to have a bypass operation. Those involve big changes in patients' routines. They often involve a lot of perceived risk, even though we do many of those operations per year. And it's a major lifetime event for patients. And so it wouldn't be strange for them to seek some reassurance on those opinions. The catheterization actually would be something that most insurance would cover because it is considered potentially a life-threatening procedure. In terms of a murmur or medical recommendations, patients seek second opinions on those all the time, and then it's really up to the individual insurer as to whether they do reimburse for that. But patients typically, in general, seek second opinions when they're unsure about a first opinion or it seems like a more serious thing than they were expecting.
How does someone go about seeking a second opinion?
We actually have a second opinion clinic here at UMass Memorial. We have a website. We also have a phone number where folks can call. Easiest way to get through is always 1-855-UMass-MD, which is our central number. It's a clinic that's designed for second opinions, so that way people don't have to feel sheepish about asking for one. It's also a situation where we expect to spend some time talking with the patients, so they won't feel rushed and they'll have a full understanding of why we would recommend what we recommend. We have reserved 3 of our senior clinicians to see patients to render second opinions. These are 3 of our clinicians who've been around a long time, seen a lot of different things, and are very comfortable having discussions with patients about these things.
What should a patient bring to an appointment for a second opinion?
I've never heard a complaint that a patient has brought too much information to a second opinion appointment. So if one can bring all the information they have that generated the first opinion, including copies of the medical records, copies of any tests that have been done, that can be extraordinarily helpful because then it can perhaps prevent us from having to order a second set of tests at this institution, which just delays our ability to render the opinion.